Many children and adults have a food allergy, which means they have to cut out one or more foods from their diet. On World Food Day, I want to talk about the importance of maintaining a healthy diet when you have a food allergy. The dietary management of food allergy is not just about cutting out certain foods. There needs to be consideration of the whole diet and of the individual likes and dislikes. We know that the diversity of the diet in infancy, which is the number of different food groups eaten, may help to prevent allergies. Also, early introduction of foods has been shown to prevent food allergy in children at a high risk. So we know that optimal food intake is also important for growth. The common foods triggering allergies contain many different nutrients, and so removing one or two food groups from the diet because of an allergy can result in a low intake of energy or protein, and also certain vitamins and minerals depending on the food. It has been shown that children with a food allergy who are avoiding certain foods can often have a poor nutritional intake, which can affect their weight and height, but can also result in them being overweight because of a lack of choice. This effect gets worse if people are avoiding more than one or two foods and can lead to food aversion and therefore a further reduction in the nutritional intake. So it's very important that all those with a food allergy, whether they're a child or an adult, has access to individual dietary counselling to make sure that any nutritional issues are overcome. It's these things such as nutritional issues, dietary restrictions, social factors and increased requirements all need to be taken into account when giving individualised dietary advice. So which foods are most often needing to be excluded? This chart shows that milk and egg are the most common causes of food allergy in young children, but as they get older, other foods such as peanuts and tree nuts become more important. In older children and adults, fruits and vegetables and shellfish are also important food triggers. Milk is one of the most common food allergens and often starts in infancy. Probably the most important part of dietary management is to make sure that the infant has a special infant formula milk. Other mammalian milks, such as goat and sheep milk, are not suitable, and in infants and young children, plant milks are not suitable either, especially rice milk, which has a higher arsenic level. Milk and also egg allergy often resolve in childhood, and so it is important to test for this regularly and try reintroducing milk and egg in a controlled way in different stages, starting with well-baked products such as milk in a biscuit and ending up with raw milk. This is called a ladder, and milk and egg ladders are an important part of the dietary management to help liberalise the diet. Plant-based diets are very healthy and have been linked to a reduced risk of non-communicable diseases such as heart disease and cancer. Many more people are cutting out meat or becoming a vegetarian or vegan, especially young adults. It is not always realised that fruits and vegetables can cause allergies, and people have had reactions to smoothies, soya milk and superfoods such as pomegranate. In fact, one of the most common food allergies, especially in adults, involves reactions to fruits and vegetables. It is called pollen food syndrome or oral allergy syndrome and affects people with a pollen allergy who usually also have hay fever. They get reactions immediately on biting and chewing raw fruits and nuts and sometimes vegetables. It is important that people with pollen food syndrome get good dietary counselling, as they often have symptoms to a number of foods. This allergy may become more common in future due to increasing levels of carbon dioxide and ozone in the atmosphere, causing increasing pollen concentration. Peanuts and tree nuts are common food allergens, and we know that these allergies can often resolve, so it is important to check for this. Adults with new onset symptoms to nuts may have pollen food syndrome rather than a nut allergy, and this can affect the way that the diet is managed. Many people with peanut allergy can eat tree nuts and vice versa, but it can be quite common for them to cut all nuts out of their diet. So when managing a nut allergy, it's important not to give individual advice so that the diet can be optimized, especially if someone's following a vegetarian or vegan diet. There are many foods that contain nuts, and this can overly restrict the diet. Obviously, nuts may be needed to be introduced in hospital or at home as appropriate. Wheat is a common childhood allergy, but many adults avoid wheat for health reasons. However, we know that a gluten-free or wheat-free diet can be low in protein and certain vitamins and minerals. Shellfish allergy is now a very common allergy, especially in adults, possibly due to the massive increase in the availability of shellfish due to farming. The rise in the use of insects and mealworms in foods could in the future cause a major problem for people with a shellfish allergy, so the increased use of labelling will become important. So in summary, milk-free diets are often low in protein and calcium, and milk substitutes need to be age appropriate. Patients with pollen food syndrome, especially who are vegetarian or vegan, really do need individual management advice. We need to make sure that we optimize the diets of people with an allergy to tree nuts or peanuts. And remember that gluten-free diets may be considered healthy, but actually they may often be low in calcium, iron, zinc, folate and fibre, and gluten-free products low in protein. Food labelling is helpful, but it only covers certain foods, and information on food allergens may not be available on non-packaged foods or in restaurants. The dietary management of food allergy is not just about cutting foods out, and poor dietary management can lead to nutritional issues. Also, people may be following dietary trends that cause a problem. New food allergens are emerging all the time, and we have to take account of environmental changes affecting food allergy. We're keen to try new initiatives such as encouraging dietary diversity from infancy, ensuring that healthy eating is really considered when excluding or reintroducing foods. We want to raise awareness of the nutritional needs of people with a food allergy and give them advice on how to instigate and personalise a diet. Food allergy can be lifelong. We need to make sure enough attention is given to the nutritional quality of the diet, and also, really importantly, keep checking for resolution. Thank you for listening.